Good afternoon, and thank you for joining us today as we gather to bring an update on the ongoing Zika case investigation here in the City of McAllen. My name is Xochitl Mora, Director of Office of Communications for the City of McAllen. Joining me today are Eddie Olivares, who's the Chief Administrator of Hidalgo County Health and Human Services, and Josh Ramirez, who's the Director of our Health and Environmental Department here for the City of McAllen. Also here present with us today are Mr. Jeff Johnston, who is the Assistant City Manager for the City of McAllen, and Kevin Pagan, City Attorney for the City of McAllen. I will now like to bring up Mr. Olivares to give us an update on the investigation.
Thank you. Well, good afternoon, everyone. Eddie Olivares, Chief Administrative Officer of Hidalgo County Health and Human Services. I'm excited to be here this afternoon to help get more information and put everything in perspective. Today I want to read a quick statement, and I will be answering any questions afterward if you like in regards to clinical input. I want to thank the City of McAllen and the Department of State Health Services and our partners at the CDC. At this point, our public health Zika investigation has been unable to conclusively determine if this is a localized Zika case. However, we cannot rule out this case was transmitted by a mosquito in our community, which really reinforces our community's efforts and the need for preventative measures and adequate testing. We, in partnership with the cities, will continue to take action to eliminate mosquitoes in their breeding habitat, and that everyone in Hidalgo County should do their part to prevent mosquito-borne illness by draining standing water, clearing weedy lots, and wearing long-sleeve clothes, long-sleeve shirts, long-sleeve pants, and using DEET products. I will stick around afterwards to answer any clinical questions that may be asked.
Thank you, Mr. Olivares. I'd like to bring up Josh Ramirez with the City of McAllen to discuss the environmental response, the vector control that the City of McAllen is taking place.
Good afternoon, thank you. My name is Josh Ramirez. I'm Director for the Health and Code Enforcement Department for the City of McAllen. As of last week, the City of McAllen has been sprayed. We finished over the weekend. We sprayed the entire city for mosquito activities. We set up traps on Thursday and Friday. Those mosquitoes that we collected on those traps were extremely low, indicative to Aedes aegypti species in comparison to the Culex species. So therefore, very low percentage of transmission of this virus. We've been proactive with code enforcement on eradicating any code violations that currently exist, removing weedy lots, and also addressing standing water and other possible violations throughout the city. We're going to continue being proactive, keeping an eye also on the weather, which has a huge factor on our continuous spraying. Depending on the weather this week, we will gear up for another spraying. Thank you.
I just wanted to also add that Kevin Pagan is the Emergency Management Coordinator for the City of McAllen. That concludes the official remarks by each of our representatives here for the Zika case investigation. However, if you have any questions, you can direct it to either Mr. Olivares or to Mr. Ramirez.
Is there any questions? I'd like to add a comment that Josh said. City of McAllen and our communities across the Hidalgo County have done a very good job in collecting specimens of mosquitoes. Josh actually has served as one of the leads for our trapping capabilities here in Hidalgo County. Right now, as of today, all the mosquitoes that have been sent for analysis to determine if Zika's in them, the Aedes aegypti mosquito, none have come back positive for Zika. So as of this point, there is no confirmation of Zika in any of our mosquitoes. However, it's very important to highlight the fact, again, like I did last week, that Zika has been confirmed in Brownsville, has been confirmed in our neighboring communities to the south in Reynosa, Matamoros, Diaz Ordaz. There is travelers cases confirmed in Hidalgo County. There is traveler cases in Willacy, Starr County, and Cameron County. The reality is that we as a community need to take a very proactive stance. Individual residents need to take a very proactive stance in protecting themselves and their family members from mosquito bites. Please repair your window screens, your door screens. Please use repellent. Wear long sleeve shirts, long sleeve pants, long pants when you're outside. It's very important that we follow through with that. I wasn't sure if you want to add anything to that. Josh, you okay with that? We're open to any questions or individual interviews. We'll follow the City of McAllen's lead. Okay?
Thank you.
Yes, ma'am.
How prevalent is the Aedes
Aedes
aegypti
aegypti.
that carries how prevalent is that in Hidalgo County on this?
In the county in general?
Okay, in Hidalgo County, our trapping is actually, I would say the ratio of 8, for clarity, just so everyone can understand, in Hidalgo County, we have 26 different types of mosquitoes that we've trapped. There's 38 known mosquitoes, but 26 we've trapped. The ones we're looking for are 2 particular types, the Aedes aegypti and the Aedes albopicus. And those are the ones that carry dengue, Zika, and chikungunya. Right now, the ratio in the county, the ratio of Aedes to other mosquitoes is extremely low. For example, one of our traps may have 40, 50, 60, 70 mosquitoes and none are Aedes. Or you might have 100 mosquitoes and only 1 is Aedes. So it's a very small ratio in the county. I'll let Josh talk about the city of McAllen.
No, it's pretty much the same for the City of McAllen. The traps that we set up, and we collected about 10 traps, the numbers that we got were about 20-some culex, and in one trap we collected 1 Aedes aegypti. So they're extremely low at this time.
Okay. You had a patient. What were their symptoms?
The primary symptoms for Zika are the number 1 symptom that's a concern is a body rash. A lot of people confuse for the mosquito bites and you get that welt for the mosquito. That's not the rash we're talking about. We're talking about a body rash that covers pretty much the chest, stomach area, arms, even legs, and it is like hives. It looks like hives, what we consider hives. That body rash is number 1. Number 2 is a low-grade fever up to about 101, body aches, and then, but the most obvious one besides the rash is conjunctivitis or redness of the eyes, where the white part of your eye turns red, red, red. Those are sure signs of Zika, and we ask anyone who has 2 of those symptoms, go to the doctor and talk to your doctor. We ask that all pregnant women make sure that you consult with your physician to get tested your first trimester and your second trimester. Very, very important. And we encourage that because in rare cases, Zika can be transmitted sexually, that it's important that protective sex is practiced and that it's encouraged to discourage any type of transmission sexually of Zika between partners. Other questions?
From what I've read, it's last 2 to 7 days. It's like a cold in many ways. This patient, what is their status right now?
Right, so the status right now, the patient 0 is no longer infectious, okay? However, you're absolutely right, and I actually credit you for researching this because it's really important. There is a window of about 7 to 10 days that a person can be infectious in that time period, but it's important. It does not transmit to humans easily. The concern is if you get a mosquito bite and that mosquito getting infected and passing it to another person. It's about a 7 to 10 day window. The only part that may be transferred from human to human is in those rare cases if there is a case where Zika has been transferred to semen in men and vaginal fluid in women, that there is those cases that you may have a sexual transmission of Zika. But all indications are that is not a common scenario, but it is a possible scenario. Other questions? Go ahead.
Just to confirm, this person was positive for Zika?
Yes. And the way that guidance works by the state of Texas and the CDC, the person, right now, there's many people who are being tested for Zika across the state. And here in South Texas, as you know, the 6 southernmost counties in South Texas have been designated as high-risk counties by the Commissioner of Health in the state of Texas. So this person presented with symptoms, patient 0 presented with symptoms, more than what is recommended. Actually, I think it was 3 of the 4 symptoms. Testing was done, guidance were followed, came back positive from a private laboratory, and then we went ahead and followed through with our investigation and proceeded to get that data to the state. Right now, it's inconclusive. So, and what we mean by inconclusive is we cannot 100% say it was a local case, but we cannot 100% say it wasn't. And it has to do with the way the investigatory process goes. But the reality is, this is to heighten the importance of the community being aware and prepared and prevent these type of illnesses and exposure to mosquitoes.
And I'm sorry, what was the timetable when this first the patient?
I don't have the notes from last interview. I think I gave the dates the last time. I think it was February. I don't have my notes with it, the 21st or something. It was interview, in the last interview I gave the timetable. Yeah. Okay. Other questions? And who are you with? What agency?
With the Progress Times newspaper.
Gotcha. Great. Yes, sir.
Why can't you determine that it was sensible?
Because one, we don't have any mosquitoes that are, like we just said, we don't have any mosquitoes that are positive for Zika. So that right there eliminates part of it. The other part is part of our investigation. There are certain processes we have to go through with our clients. And at this point, the information that was given to us by patient 0 does not indicate that it may have been localized, but there's no clear indication that it may have been a traveler. So what happens, we get caught in a difficult case when we're trying to keep confidentiality of the patient and keep that confidentiality in place. There's certain, we are going by what is reported to us by patient and by physician, and based on those things, we make that determination. Unfortunately, at this level, the information we've gotten, we cannot confer 100% that the person had not traveled to other places, but we cannot deny that they haven't either. So we're having to deal with those issues. It's very difficult. Everyone has got their rights and their individual personalities, and we have to deal with what we have.
So it was transmitted somehow, either from another person or?
Right now, the indications are that we are not sure, okay? That's yet to be determined, all right?
So as more time goes on with this,
Patient 0 is no longer infectious, so it's not an issue. But the concern is that here in South Texas, the weather's changing. We're coming onto the rainy season. We're coming onto hurricane season. The possibility of Zika is high just because of the conditions we may get during the rainy season and wet season, and the fact that the cases are in Mexico. The country of Mexico has reported several thousand cases, and there's been hundreds of cases here along the U.S.-Mexico border. And we do have the travelers, and we do have the confirmed localized cases in Cameron County. So just statistically speaking and geographically speaking, we are primed to deal with Zika cases in the future.
Can we get a general area where this person,
The City of McAllen.
like, is it no zone or anything? South?
Right now, the City of McAllen is the area, and that we're following our guidance in the investigation, and we cannot give that information further at this point.
what can the CDC give you that the patient can't craft with the case data?
The CDC has specialized laboratory analysis and testing that they can give information that at a clinical level and at a microbiology level that would be useful to have, but it cannot give us any other indications beyond what the patient can give us through the interviews and investigation. The number one source of information we get is directly from the patient. But we got to adhere to certain rules and protocols within that level as well. Thank you.